Well, September is National Suicide Prevention Month, and it's important to know that there are new resources to help you or loved ones in need. So Intermountain Health, the sponsors of today's segment, are here to help. And joining us now from Intermountain Health is Letitia Morgan. Letitia, thank you so much for being here.
Thank you so much for having us.
So a really important topic to discuss, but I want to jump right into it because I know that you guys have put a lot of effort into your hotline. So can you tell us a little bit about that and how that maybe helps people out there?
Yes, so that hotline is a resource for everyone here in the Valley. It's not just for Intermountain patients, so they can call there, can receive resources and that first step of knowing where to go.
And I know you guys are really emphasizing no, help, cope. Can you kind of break that down for us and what each of those mean if we're maybe trying to help someone in need?
Yeah, so the first is asking someone, do they need help? If you see it and you recognize it, there's nothing wrong with asking. A lot of times people need that. They need to know that someone cares. And then being able to cope, with everything that's going on, is that knowing that you're not alone, you're not by yourself, and that there are different things that you can do, whether it's self-care, whether it's reaching out to a mental health professional.
And I know there's always kind of been this stigma about just being able to talk about it openly, and that's why some people are maybe afraid to voice how they're really feeling. How can we as a community help to destigmatize that and just show our loved ones that we love and support them?
That's the biggest way right there, is to show them that you love them and you support them, listening to them, hearing what they have to say, and letting them know that they are valued. One of our sayings is, tomorrow needs you. So being there for them, listening and helping them find those resources, or even holding their hand to go to an appointment.
And in addition to the hotline, what other resources do you guys provide that might be helpful to especially parents out there who know that their child is struggling?
So we have the 988 number, which is just like our resource line, but if it's imminent, you can always dial 911, but we provide individual therapy here at Intermountain.
And let's talk about resilience for a minute. I know you kind of use that as a balanced scale. What does that mean exactly, and how can we kind of explain that to those who really need to hear it?
It's just like a scale. It's up and down, and finding that balance, that sometimes it will be down and then sometimes it will be up. But most importantly is when you're receiving help or you're reaching out for help, you're trying to find that balance.
And what signs, kind of coming back to parents here for a minute, should they kind of keep an eye out for when it comes to their children? I think we're seeing it more and more in young children when it comes to suicide. Are there things that parents can just keep in mind every day to make sure that their child's doing okay?
Yeah, if you notice that they're starting to withdraw, or they're talking about death more frequently, if they're giving their things away. So those are some of the things that you really can focus on, and especially the withdrawal part. If you have a kid who, even if they are kind of to themselves, but they're to themselves more than normal, or you have this outgoing person and then all of a sudden they don't want to engage and they don't want to go out and do things, check in on them.
Absolutely. And September is National Suicide Prevention Month, but it's important obviously year-round to talk about. So if people want to help or just learn more throughout the year, especially in September, how can they get more information, or where do you suggest that they start?
They can always contact us at Intermountain Health, but calling the 988 number, because it's not just about crisis, it's about finding those resources and pointing you in the right direction as well.
Well, Letitia, thank you for everything that you and everyone at Intermountain Health are doing to, help our community out. This hotline is really, really important, and I'm so happy to hear that you're continuing to put the efforts in to make that, much more accessible for those who need it. So thank you so much for being here. We really appreciate it, and thank you to Intermountain Health for sponsoring this segment. For more information, you can visit intermountainNV.org. Las Vegas Now. We'll be right back.